Today is your first day of pediatric ward. I would like to tell you about history taking. Before we start, few important points I would like to mention. Always print the name of the patient, date of birth or age, the weight of the infant or child on the history sheet, or simply put the identification sticker. I start with chief complaints or presenting complaints, which are one and same thing. Remember that all presenting or chief complaints are mentioned in parents' language and you don't mention technical terms. It's whatever mother describe in local language. I gave you an example like a child presents you with vomiting or fever. So the question need to be asked are, the time of start of this symptom, the frequency, the amount, the color, presence of any blood. Similarly for fever you should know its time of onset, its frequency, duration, any chills or rigors and other associated features, and lastly how it gets better, like by taking a medicine or tepid sponging. The history of present illness should describe all these complaints in detail. Once you have done this, go through the systemic review, which means asking about all other systems one by one, like any cranial nervous system, symptoms of respiratory system symptoms, etc., so that all systems are well covered. In past medical history, you inquire about any past history of such symptoms or any other previous illnesses, any hospitalizations. History of any surgical procedures or fractures. In medication history, you try to know the current and past medications related to this particular illness or any regular medications child is taking. Try to document the dosage and names if possible. Now, I will explain you few differences in medical and pediatric histories, as in pediatric histories, there are few major differences. This start with taking the history about birth, feeding, vaccination, developmental, schooling. Birth history consists of period of gestation like full term or premature, the mode of delivery, birth weight. History of consanguinity is important to know. Always draw a family tree. We will help you to learn it. Feeding history means mode of feeding, which could be mother or formula fed, and then about stating about weaning diets as its age when solid food was started. Regarding vaccination history, first of all you should know about the normal schedule of vaccination like BCG and polio drops at birth, pentavalent, oral rotavirus and polio drops at 6 and 10 weeks. At 14 weeks, they again get the third lot of pentavalent vaccine. They should get measles vaccines at 9 and 15 months. I suggest you go back and read about vaccinations, its types, mode of delivery, and what is EPI or Extended Program of Immunization in Pakistan. Check it on www.epi.government.pk website. Now, developmental history is very important as we are dealing with a child which will going through different stages of development. This includes different skills of neck holding, sitting and walking. These are called gross motor skill. Similarly, there are fine motor, speech and language development skill. Your next task is to go and read about different developmental milestone in children. Lastly, schooling. Before I mention schooling, remember, we are dealing pediatrics which start from birth, up to 14 to 16 years, so, our history is very diverse. For a 1-year-old child, nutrition and development milestones rare important, but for 6 years old, his schooling and academic performance is more important to know. Social economic conditions like, what father works at or, parents' profession if both are working. Their living conditions like, a mud house or a brick-made home. This almost finishes our history section before we move on to the GPE or general physical examination. Let us know if you have any questions. Please, don't forget your 2 tasks.